Okay, ni sto kok makuina skiaki. No to gana. I am a family physician. I've been practicing on the blood reserve for 20 years, the emergency room in Cardston, and just generally involved in the community activities and hoping our community gets healthier and is safer. I think our community response has been good. We initially, in the phase 1, we looked at finishing or doing the elders 65 plus, and we calculated that we had approximately 750 elders, and most of them have been vaccinated. We've probably got at least 70% of the elders vaccinated in that first phase. So we're hoping that the remainder come in through this phase 2 and get theirs done. Blood Tribe and most of the First Nations have been able to decide on their own criteria for each phase. So because we know we have lost a number of people that have had diabetes or a chronic illness, we have extended the years. Initially it was from 59, I think, to 59 plus, but we've extended ours right to 18 plus years. And today we've extended anyone turning 18 within the 2021 year. So what we're trying to do is we're trying to get ahead of the variant. So we need to get as many people as possible in our community vaccinated to help save those who are either unvaccinated or have the possibility of getting really sick with the variant. And we know that the 3 variants that are occurring in and around the community are the UK variant, which we have had positive cases of, the Brazilian variant, and the South African variant. And the Brazilian variant is thought to be very deadly. So we want to get our people vaccinated before those variants get into our community. We know that it will be a tough battle once they get here because we're going to have to continue to socially isolate, and it may be very strict isolation measures if we cannot get ahead of these variants. We've experienced the UK variant, and we have had the thing about the UK variant is that it spreads, it's more contagious than what they call the wild or the earlier COVID-19 virus. So what happens is the virus itself, once it gets into a person's body, what's the term? It starts to mutate because it's generations of the virus. So every time the virus divides into more viruses, then it becomes another generation. And it's hundreds of generations in our body once we get the virus. So the mutation starts. So it starts to change and evolve into a different type of virus, or the same virus but a different characteristic. So what we're seeing is that the UK variant was very contagious. And initially, with the initial COVID-19, we were looking at 6 feet apart. We're looking at making sure we're masking, we're washing our hands. But what they're saying with the UK variant is you can be 10 feet apart. So possibly from me to you would be a possible exposure to the UK variant. And they were talking about being in the presence of somebody with the original COVID for 15 minutes. And that would be, you would be considered a contact. But now with the UK variant, it's 1 minute and 10 feet. So you can pass somebody by in a store, on a street, and you can be exposed. And the UK variant, you can go home not knowing that you have it and spread it to every one of your family members. So the characteristic of having that much or having it that contagious is very worrisome in our communities. Yes, we have had it, and we have experienced how quickly it spreads, because it was in a workplace. Only a few minutes of one individual at a workplace infected everyone in that workplace. So we know that the risk of somebody getting it in the workplace or in homes and people going from home to home the risk is really high that we could have it in our community spreading within, let's say, 2 days to 5 days. We could start doubling the caseload that we have. We know for sure that there are people in the Blackfoot Confederacy who have had both of the vaccines, they've had both doses, and still got the variant. So that is why we have to be really careful about our social isolation and why we have to get as many people vaccinated as possible. We know that if a person is vaccinated, their symptoms are much less severe than if they're not vaccinated. So those individuals who were vaccinated and did get the variant had very mild symptoms. I think a number of things. One is that until you actually lose someone, you don't recognize how deadly it can be. Until you've had a loved one that's had to be in ICU for several weeks and has lived through COVID, they can tell you how awful the experience is. Until we recognize that it is real, it is deadly, and it can change a person's life forever, we realize how serious it is. And I really want to commend our community and the Blackfoot Confederacy, because the behavior of the people in our community has been very good. And basically, it's behavior that's going to save us from the spread of the virus in our community. So I really think that our people took it seriously very early on. Masking, being really careful. In fact, you hear from non-Indigenous people in Lethbridge and Cardston that they were actually our people were being made fun of because we were the first ones to start wearing masks everywhere. And I have heard from many people that you would see our people slide their sleeves up to open and close the door. So I think I would like to commend our communities for taking it seriously, wearing their masks everywhere, trying to obey the isolation precautions. And if they had not done that, our numbers would have been worse. So I think our people have really been impacted, but also have really stepped up to doing the right things. It's had a huge impact. For the non-healthcare workers, we have lost a record number of people. We have not lost this many people in a year. I think it was 167 members that we have lost. We have an anecdotal breakdown of the numbers that we've lost. We've lost 8 people on the blood reserve to COVID, and that's counting on reserve, not off reserve, so we've lost more than that. But we have lost a significant number of people to opioid overdose and increased alcohol-related death and suicide. We've seen more suicide in our community. And a lot of it is, I think, one is that because our healthcare workers have been so busy with trying to combat COVID, that we haven't really had the manpower to start working on or reactivating our opioid overdose strategy, which we are doing now. But many of those services have not been as reactive as we were before. And we know that one of the impacts, the huge impact to blood reserve, was the closing of the safe consumption site in Lethbridge. Many of our people that have died from overdose are dying in the back alleys, in the basements, and in places where they're all alone because they have no place to be safe. And they're also shunned and shamed by many of the citizens of Lethbridge. So our people have gone from bad to worse to a very serious situation. So what we need to do is we need to call our people home and start working on solutions here at home. The outside communities are not very understanding of what an opioid addiction is, and they treat our people very inhumanely. And so I think we need to start developing our own made-at-home strategy and show our compassion for our people. I think everybody's tired. Everybody does talk about being extremely fatigued at the end of the day. And behind me you'll see all the nurses and healthcare workers who have been continuously working at this, starting with information education, and then our testing strategy. Blood Reserve has been very proactive in testing and recognizing that testing for COVID helps us to identify and contact trace as fast as possible. So that has actually been really heavy on our community health staff, and we have had the EMS step in, and so our Blood Tribe EMS has done a very heavy load of the testing, and they have carried a lot of it as well. So I think we need to, at the end of all of this, commend our community health workers, our team. The really strong thing about Kainai is that we've had collaboration between all departments since the beginning of the COVID crisis. So the DEM, Rick Soup, and Annette Nadine Tailfeathers have really done a lot of work in terms of bringing everybody together to collaborate. So not only is it the healthcare workers, it's also our entire Blood Tribe team that has been working on this COVID response. And now we are reactivating the core group to begin with our opioid strategy. Well, our goal is to get at least 70% of our people vaccinated, so what they call herd immunity, which we really don't want to use in Indigenous communities, but it means that if we can get 70% of our people immunized, we can help save those who are not immunized, so our children and those who for some reason were unable to immunize or refused to be immunized. The goal is to try to keep our entire community safe, and we can do that by getting 70% of our people immunized. Initially, it was really good, and we've had really good uptake on weekdays. This is our first weekend vaccination clinic, and perhaps people weren't ready for it, or just were not understanding that they could come in as walk-ins without making an appointment. So it's been kind of slow. It should pick up again this coming week, and we will continue the vaccination clinics until our vaccines are complete. We want to use all the vaccines that we've been delegated or designated, so we can get as many people vaccinated as possible. Today is a change in terms of accepting 17-year-olds who will turn 18 in 2021. So we are seeing a few come through the door now, but we really need to push our tribe to be safe. We're going to complete our first dose, and the aim is to get as many people vaccinated with the first dose as possible, because the current vaccine that we're using is the Moderna, and Moderna after 14 days gives you about 95% immunity. So the more people that are vaccinated, the safer our community is going to be. So it's basically a community action that we need to take, and we have in the past, our actions have all been based on a community-wide approach. It's hard to say. Our numbers were high when they booked all the appointments for our elders. We did get very good uptake. There are some elders that are still reluctant because they are afraid of the vaccine. And I just want to remind people that it isn't actually the virus that you're getting. And if I can use my hands, the pictures that you see on TV where there's a ball and there's a bunch of spikes around the ball, what an mRNA vaccine is that it takes and it duplicates those spikes around the virus. The actual core of the virus inside the ball is what contains the deadly or the virus that makes you very, very sick. So that doesn't go into our body at all. All that the mRNA is that they duplicate or they imitate the proteins on the outside of the virus. So when they give you the vaccine, the vaccine has duplicates of that mRNA or those spikes. So your body is taught to recognize those spikes. It's kind of like recognizing the enemy. And so when the actual virus comes to your body, your immune system is taught to destroy that protein immediately, so that it doesn't infect your body. So we're basically educating our bodies to recognize the COVID virus and destroy it before it destroys us. I think the sooner we do this, the better it's going to be. Hopefully we can have Sundance this year, and in a safe Sundance. We did well last year, but if we can get herd immunity or 70%, then I think we're going to be happy at Sundance this year. I hope so, but it might be too early. I think August might be, because our Sundance is usually early August. I'm thinking that we could be realistically looking at a safer Sundance, but July for Indian Days is a bit early. There might be actually Indian Days with some precautions. So, I mean, the more people get vaccinated, the faster we're going to get back to the things we love doing.